Welcome to the 10th module for the Global DARE Foundation Patient Collaborator Training Series. My name is Mousumi Bose, and I will be your narrator throughout these training modules to help you become an active patient collaborator in ongoing and upcoming research for adult refsum disease. This module will provide an overview of current and emerging therapies for adult refsum disease. We'll start with a brief review of adult refsum and discuss the current treatment approaches that are used today, along with some of their limitations. Then, we'll explore several emerging therapies and rare disease treatment options, including gene therapy, gene editing using CRISPR technology, and antisense oligonucleotide or ASO therapy. Throughout this module, we'll also look at real-world case studies to help illustrate how these therapies are being applied in rare disease. Before discussing treatments in rare disease, let's briefly review what adult refsum disease is. As you probably know, adult refsum disease is a very rare inherited disorder that affects about 1 in 1 million people. It is mainly caused by changes in the gene that encodes for the phytanyl-CoA hydroxylase enzyme, which normally helps break down a fatty acid called phytanic acid. When the body cannot properly break down phytanic acid, it builds up over time and can lead to a wide range of symptoms affecting vision, hearing, balance, nerves, and other body systems. Current treatment for adult refsum disease mainly focuses on managing phytanic acid levels through the diet. Individuals that are diagnosed with adult refsum are advised to restrict foods high in phytanic acid, which is primarily found in full-fat dairy products and meats from ruminant animals, meaning like cattle, sheep, goat, and deer. In addition to dietary restriction, maintaining regular meals and adequate carbohydrate intake is important, especially during exercise, illness, or times of metabolic stress, because fasting and sudden weight loss can worsen symptoms of the disease. Diagnosed individuals are also encouraged to ensure that they are getting enough essential fatty acids, vitamins, particularly the fat-soluble vitamins, and minerals, while avoiding excess caffeine, as well as medications that can increase fat burning through various mechanisms like, say, stimulating thyroid activity. In severe illness or surgical situations, additional nutritional support may be needed to help prevent complications related to the disorder. For individuals with adult refsum disease, dietary management is the main treatment approach, but there are also medical procedures that can help lower phytanic acid levels during severe cases or during a health crisis. So you may know that fats from the diet or those made in the body don't like to travel freely in the blood because fats are hydrophobic or water-fearing, and blood is made up of mostly water. So fats in the blood, they need carriers to help them travel in the blood without issue. And these carriers of fats are called lipoproteins. Treatments like plasmapheresis and lipid apheresis can help remove phytanic acid from circulation via lipoprotein removal. Plasmapheresis works by removing whole plasma and replacing it, while lipid apheresis specifically removes the phytanic acid-rich lipoproteins before returning the cleansed plasma back to the body, like a kind of dialysis except for fats. These approaches can significantly reduce phytanic acid levels in the short term, but the effects are temporary, and levels can rise again relatively quickly due to a rebound effect. While current treatment approaches can help manage adult refsum symptoms, they also come with several important limitations. Some symptoms, especially neurological or vision-related changes, may be irreversible once damage has occurred. Many individuals diagnosed with adult refsum also face challenges with long-term dietary adherence, since phytanic acid restriction can be difficult to maintain consistently over time. In addition, metabolic stress from illness, fasting, or surgery can quickly worsen symptoms, even in patients who are carefully managing their condition. And as I mentioned before, treatments like plasmapheresis and lipid apheresis can temporarily lower phytanic acid levels. Um, but because due to the nature of these approaches, they are not used frequently and levels may rebound quickly afterwards. All of these approaches require continuous monitoring and management, and at this time, there's still no long-term cure for adult refsum disease, highlighting the need for newer and more effective therapies. So I want to bridge the topics of understanding current treatments for adult refsum with emerging therapies for rare diseases by first discussing why it's important that we keep updated on emerging therapies in rare disease overall, even if these approaches don't currently apply to adult refsum disease. Understanding emerging therapies in rare disease is important because it helps patients, families, as well as patient collaborators stay informed about where rare disease research may be headed. It also provides context for how new treatments are developed, tested, and eventually brought into clinical care. As research continues to advance rapidly, being informed allows communities to better understand clinical trials, um, announcements for research, and future treatment possibilities. Now, let's talk about some of the exciting therapies being explored for rare diseases. These approaches generally fall into two big categories: biochemical based interventions and gene based therapies. Biochemical approaches include things like enzyme or protein replacement therapy, as well as drug repurposing, where existing medications may help improve some metabolic pathway that's affected in the disease. Gene-based therapies focus on targeting the genetic cause of the disease through techniques like traditional gene therapy, CRISPR gene editing, and antisense oligonucleotide or ASO therapy. While many of these treatments are still being researched, they represent promising new directions for treating rare genetic disorders like adult refsum. Let's dig a little deeper into these approaches and highlight the need for multiple types of therapies. Not all rare diseases can be treated the same way, which is why different therapies are designed to target different problems. Some approaches, like dietary or metabolic therapies, help reduce harmful substances that build up in the body, while enzyme or protein replacement therapies provide what the body is missing. Gene therapy works by adding a functional copy of a gene. Gene editing, like CRISPR, aims to directly fix the error in the DNA, and RNA targeted therapies like antisense oligonucleotide or ASO therapy changes how these genetic instructions are processed. In some cases, combining multiple approaches may offer the best outcomes. So let's talk about a biochemical approach, a biochemical treatment approach that may be relevant to adult refsum disease. So as you may know, normally the body breaks down phytanic acid through a process called alpha oxidation. But in adult refsum, this pathway doesn't function properly, um, and, and as a result, phytanic acid builds up. The body does also breaks down phytanic acid on a backup pathway called omega oxidation. However, this happens at a much lower frequency than alpha oxidation, which is why phytanic acid still builds up in adult refsum. This omega oxidation process takes place mainly in the liver cells, and as a result of that phytanic acid breakdown through omega oxidation, it produces different compounds than the alpha oxidation pathway. But the important thing to remember here is that this omega oxidation pathway does aid in some clearance of phytanic acid. There's these specific liver enzymes that help carry out this omega oxidation pathway. And researchers are now interested in a class of drugs called fibrates because they may boost or increase omega oxidation activity. And this might help the body clear phytanic acid more effectively in adult refsum. So let's move on to some genetic-based therapies. So to date, these approaches have not been implemented in adult refsum disease, but some of these approaches are in the preliminary stages of research to determine applicability to adult refsum. I'm going to start with traditional gene therapy. And this approach focuses on delivering a healthy copy of a gene into the body's cells to help restore normal function in the body. Now remember, a gene, which is made up of a little stretch of DNA, contains the instructions on how to make one protein in that cell. And in genetic disorders, oftentimes there is an error in the instructions or those genes for one or more specific proteins. So the way that gene therapy works is using recombinant DNA technology. So what researchers, scientists, clinicians do is place a corrected copy, that is not an error, a corrected copy of this gene into a carrier molecule that's called a vector. And this vector is then can be transported into target cells carrying this correct gene so that it can be incorporated into that cell's DNA. These vectors or carriers can include things called plasmids, nanoparticles, or modified viruses that are designed to safely deliver this genetic material into the target cells. While this approach has shown promise for many rare genetic diseases, and I'm going to give you a case study in just a second, as I said previously, this approach is not currently an FDA-approved treatment for adult refsum disease. One big limitation of this approach is that depending on the size of that corrected gene that's to be delivered to the cells, the vector, otherwise known as this carrier for this corrected gene, may not have the size capacity that can accommodate the specific size of that corrected gene. Nevertheless, as I said previously, this approach has been applied successfully in several other rare diseases. So let's take a look at this in action. This case study follows a family whose two children were both diagnosed with a rare genetic disorder called spinal muscular atrophy, or SMA, a severe genetic neuromuscular disease that causes progressive muscle weakness and can be life-threatening if left untreated. In this family, their first daughter began showing early symptoms such as a weak cry and breathing difficulties before being diagnosed. After they received this diagnosis, they promptly received gene therapy that was specific to SMA when their daughter was 17 months old. And because the family knew that they carried this genetic variant that causes SMA, when their second child was born, and before their second child was born, they were able to diagnose prior to birth and subsequently treat this child with the gene therapy at just 10 days old before symptoms could even appear. And this story really highlights how early diagnosis combined with gene therapy options can dramatically improve outcomes for children with SMA and still offer hope to other families that are facing rare diseases where gene therapy may be an option. Gene editing is different from traditional gene therapy because instead of adding and inserting a new, healthy, correct copy of a gene, what gene editing does is directly change the error in the gene, the faulty gene already present in the DNA. One of the most common gene editing technologies is CRISPR, which works kind of like molecular scissors that can target and cut specific DNA sequences. This technology has created exciting possibilities for treating genetic diseases by correcting harmful genetic variations directly at their source. However, there are still important challenges, such as including the risk of cutting the wrong part of the DNA, the unknown long-term effects of this approach, as well as ethical concerns surrounding how this gene editing should be used. So as I mentioned, CRISPR is one of the more common types of gene editing technologies that makes direct changes on the DNA, rather than adding a new copy of a gene, which is how traditional gene therapy works. With CRISPR, it works by targeting very specific DNA sequences, allowing scientists, researchers, clinicians to correct harmful um, genetic changes, remove damaged sections of DNA, or even turn off defective genes. CRISPR, similar to traditional gene therapy or recombinant DNA technology, can be delivered into cells using tools like viruses, lipid nanoparticles, or electroporation. One major advantage to traditional gene therapy is its precision, especially for diseases caused by toxic proteins, as well as allowing for gene edits when a new copy of the gene is too large for traditional gene therapy approaches. So this case study highlights an important example and one of the first examples of personalized CRISPR therapy being used to treat a rare genetic disease. So there was a baby whose name was KJ, born with a severe metabolic disorder called CPS1 deficiency, which prevents the body from properly removing toxic ammonia. Because there were no effective treatments available, researchers at the Children's Hospital of Philadelphia and Penn Medicine developed a customized CRISPR-based therapy designed specifically for the genetic mutation that KJ had. Using this technology, scientists were able to target and edit the faulty gene in KJ's liver cells. And this treatment was created and delivered within just a few months, showing how gene editing can potentially be personalized for individual patients with rare disease. After receiving the therapy, KJ tolerated the treatment and began showing positive signs of growth and development. Another emerging gene-based treatment approach is antisense oligonucleotide or ASO therapy. So the way that ASO therapy works is that it uses these short synthetic strands of genetic material that target not DNA um, and the actual instructions, but they actually help further on down the line and help modify how this DNA, how these genes are expressed as proteins. So rather than changing the DNA itself, this therapy works at the RNA level to help the body make proteins more effectively. So you might know that when the instructions of specific genes, which are made of DNA, are made into proteins, are translated into proteins, we need to get copies of this gene to be made in order to bring that information, those instructions, from the nucleus of the cell, where the DNA or those instructions are housed, out into the machinery that actually makes the proteins, which is outside of the nucleus. So that copy that's being made, that copy of what's on that DNA, on those genes, is transcribed onto a molecule called RNA. And then once that copy is made, then the RNA can leave the nucleus, and so that information can be fed into the protein making machinery. otherwise known as the ribosomes. So this diagram shows how ASO therapy works at the RNA level. The ASO that's shown here in red is designed to bind to a specific RNA sequence. Once that ASO attaches to the RNA, it can block or change how that message, how that information is used during the process of translating this information into proteins in the ribosome. And by interfering with this process, ASO therapy can reduce the production of harmful proteins or help increase the production of needed proteins depending on the disease that's being treated. So we mentioned SMA or spinal muscular atrophy before as a disease that had a recombinant DNA type of gene therapy. SMA also has an ASO therapy, so we'll talk about that for just a little bit. So, as I mentioned before, SMA is a rare genetic condition in which the body does not produce enough of a key protein that is needed to help keep nerve cells and muscles functioning properly. And without this protein, muscles progressively weaken over time, making movement, breathing, and swallowing increasingly difficult. ASO therapy can help in the body making more of this essential protein when an individual has SMA. And this therapy has significantly improved outcomes for many patients with SMA. This breakthrough treatment was made possible through decades of research and clinical trials involving the actions of both patients and families. So this case study follows a family where their child was diagnosed with SMA. And after diagnosis, this child experienced several severe health complications, including repeated hospitalization for chest infections. And there were times when his survival was uncertain. As I mentioned before, SMA is a life-limiting disorder without treatment. But within 6 months, this child was treated with an ASO therapy that was specific to SMA, and it significantly improved his strength and quality of life, allowing him to gain muscle function instead of continuing to lose it. While ASO therapies and even gene therapies aren't cures, and this patient still requires extensive medical care, his family describes this treatment as life-changing and believes that this ASO therapy gave him the chance for a better future. So as we approach our close to this module, I think it's important to note that while there are viable therapies that are currently available for adult refsum disease, there are pretty significant limitations. And emerging therapies are transforming the future of many rare disease treatments. As we've seen different approaches such as the recombinant DNA gene therapy, CRISPR, and ASO therapy work in different ways to target specific disease mechanisms. While many of these treatments are still evolving and require years of research, clinical testing, and patient participation, they represent meaningful progress towards more effective therapies. And for adult refsum disease, this continued research and collaboration offers real hope for future treatment options. Looking ahead, our training series continues with several modules designed to deepen your understanding and engagement in rare disease research, specifically focusing on adult refsum disease. Coming up next, we will be covering how treatments are developed using translational research. So I want to thank you so much for your time in watching this module. I encourage you to complete the survey linked to this module, and I'm excited to continue guiding you through upcoming modules. I'll see you in the next session. For more information on this or other modules, please reach out directly to the Global DARE Foundation at info@globaldare.org.